Hello and welcome to this episode of DMC Medical Matters. Today we are talking about the field of maternal-fetal medicine and the important role it plays in caring for high-risk moms and babies. Joining us today is Dr. Bernard Gonik, a DMC Maternal-Fetal Medicine Specialist. Welcome, Dr. Gonik.
Thank you.
Well, first of all, let's start with what is the difference between a general OB and a maternal-fetal medicine specialist?
So both a generalist in obstetrics and gynecology and a maternal-fetal medicine specialist are both obstetrician gynecologists. So both go through 4 years of residency training after completing medical school. The maternal-fetal medicine specialist then goes on and does a 3-year fellowship. Typically it's about 3 years. And during that 3-year fellowship, they learn to deal with more complicated pregnancies. They learn some diagnostic tools and techniques. And they also carry out research in the area of maternal-fetal medicine.
And if somebody already has an OB, does that mean that they have to stop seeing them if they see a maternal-fetal medicine specialist?
No, as a matter of fact, most of the time we work in concert with their general OBGYN physician during their pregnancy, and we co-manage or can assist in the management of those patients, but they can continue to see their own obstetrician gynecologist if that's what they choose to do, and their obstetrician gynecologist is comfortable with that care.
And what is considered a high-risk pregnancy?
So high-risk pregnancy is one where any time from the beginning of the pregnancy, from conception, right on through the delivery process and even afterwards postpartum, a complication or an event occurs that changes it from whatever the norm is. So that could mean anything from before being pregnant having a comorbidity like hypertension or diabetes. That could mean during the pregnancy having an issue either related to the mom or to the developing baby, or even afterwards if mom has a complication, for example, after she's delivered the baby. All of those times can increase the acuity of the care of the patient and therefore might be defined as a high-risk pregnancy.
What are some of the specialized services that you can provide to care for the baby before it's even born?
So we can do genetic screening, for example, to look for the possibility of genetic disorder in the babies. We offer high-level ultrasonography, and that ultrasonography can detect even small abnormalities in the baby. We can sometimes do invasive testing, and we can also do various therapies for the baby, all in an effort to try to improve the outcome.
When someone's thinking about where to deliver, how important is it to consider a hospital that has maternal-fetal medicine specialists?
I think it's really important to make sure that the healthcare system that you're going to be cared for, and in this case during pregnancy, has the capabilities of managing either as a routine pregnancy, but all the way up to the highest acuity that you might need. Things can happen during pregnancy that can happen very, very quickly. And so a normal or healthy pregnancy can change pretty quickly to a complicated pregnancy, and then you want the expertise there. And again, we as maternal-fetal medicine specialists can provide that.
Do all hospitals have maternal-fetal medicine specialists?
They don't. Across the country and even locally here in Michigan, hospitals have various levels of care. And again, we're fortunate here within the Detroit Medical Center, here at the DMC at all of our birthing hospitals, Hutzel Women's Hospital, Sinai Grace Hospital, and Huron Valley Sinai Hospital. We have a full cadre of specialists who can help care for the pregnant patient and for her baby. And we have maternal-fetal medicine specialists available at all 3 of our hospitals.
Well, thanks for all that great information today. And if you are pregnant or thinking about becoming pregnant and would like to learn more about the expert care here at the DMC for taking care of moms and babies, visit us at dmc.org/baby.